Hi, I'm Daniel Nyman. On behalf of the Forum for Healthcare Strategists, as well as our colleagues at Monigle, welcome and thank you for joining us for Humanizing Content, Leveraging Segmentation to Deliver Personalized Communications. In today's webinar, you'll hear how Virtua Health has successfully connected attitudinal segments to its entire patient database, enabling the delivery of targeted content with impactful and measurable results. One note before our speakers begin. Attendees are participating in listen-only mode, but you can still ask questions. If you have a question, please enter it into the question and answer pane located on the bottom of your screen at any time. We will respond to as many questions as we can in the time we have. With that, I'll turn the program over to Grant Mason, Executive Director of Behavioral Insights at Monigle, who will be leading today's discussion. Grant?
Thank you, Daniel. Good to see everyone. Happy to have you all here today. We'll do some quick introductions, then we'll dive in. So I am Grant Mason. I head up the Behavioral Insights group at Monigle. I also lead all of our humanizing brand experience research in healthcare. Chrissie?
Hi, everyone. I'm Chrisie Scott. I'm the Chief Marketing Officer for Virtua Health.
Well, thanks for sharing your time. I'm Ryan Younger, Vice President of Marketing at Virtua, and hope your coffee or beer mug is full because we're, I think, ready to go. We're live.
Good stuff. All right, next slide, please. So obviously, the reason we're here today is to really dive into this whole subject of how we can deliver new levels of consumer engagement and activate on segmentation. Very quickly, I'll give an introduction to Monigle, and then Chris will do the same for Virtua. For those of you who don't know Monigle, we are a brand experience agency. We have a lot of deep experience in healthcare specifically. And while I head up our insights group, we do deliver on brand end to end. So we do everything from strategy to design, activation, branded environments. We very much do that end to end brand experience for our clients. And then Chrissie, if you want to give a quick intro to Virtua.
Yeah, so just to give you guys a sense of Virtua Health, so we have a really simple mission at Virtua. It's to help people be well, get well, and stay well. We're about a $3 billion academic health system in South Jersey, right outside the Philadelphia market. We are the fourth largest health system in the state, the most densely populated state in the country. In addition to our 5 hospitals, 6, if we start counting our really large hospital at home program, we have about 400 locations. We have about 41 ambulatory surgery centers, and we have a partnership with Rowan University where we have a medical school, a nursing and health professional school, and a research school. And we also, something that distinguishes us is that we have one of the largest, I'll call it a health and humanity fleet, which includes a mobile grocery store and a mobile farmers market.
And we love working with Virtua and Monigle. They very much do epitomize that idea of being a human brand in the healthcare space. Every year, we run our Humanizing Brand Experience study, which is a national study where we're evaluating over 200 healthcare brands with 26,000 plus people across the US. And every year, Virtua Health ranks in that top 20%. So they very much epitomize that humanized brand relationship that lots of healthcare brands are seeking today. So let's get into it. That was the introductions and a bit of background, but really we're here to talk about how do we deliver on a more human content strategy, and also how do we activate on segmentation. I think that segmentation is a really interesting topic in healthcare right now, but it's also a very challenging, it's a challenging research to actually activate on. So we're going to talk a bit about the background as to how we did the segmentation, why we believe in attitudinal segmentation. But really today, we're going to focus on that fusing of data sets and how do you actually deliver a personalized content strategy after you've done that segmentation. So we're going to break it down to 3 parts for you, and you're going to hear from all of us today. Chrissie's going to kick us off with a bit of background in terms of the challenge facing Virtua and why they commenced on this work in the first place. I'm then going to jump into the research itself. How do we do segmentation? What are the key principles of segmentation? And then when you're thinking about connecting your segmentation to other data sets, your patient data set, what kind of analytical approaches can you leverage to do that? And then Ryan's going to finish us off with a real focus on the implementation side of segmentation. How did Virtua actually socialize and activate this work to really drive home some incredible content with these segments? So with that, I will pass it over to Chrissie.
Thanks, Ron. So as I was kind of outlining our challenge to create personalized content that meets the varying needs of our patients and our consumers, I came across an article about Taylor Swift. No surprises there, as we're kind of sandwiched in between her history-making Grammys last weekend and the cultural force of the Super Bowl coming up. But anyway, the headline was, "Why does everyone love Taylor Swift?" And think about that for a minute. There are very few things or people who appeal to almost everyone. And before you think her fan base is mostly teens and tweens, you should know that 60% of her recent concert attendees were between the ages of 34 and 64. So there are countless experts in neuroscience, in psychology, in marketing, all trying to analyze and figure out how she's garnered this universal appeal. And the research clearly points to her ability to be highly relatable and to masterfully connect on a personal level with each segment of her massive audience. She offers something for everyone, and yet she does it as if she's having this one-on-one conversation or relationship with each fan, and or as she calls them, her friends. So you can see creating a personalized approach starts with understanding who you're talking to and what matters to them. And whether it's in entertainment or in healthcare, it's about letting people know that we get them. So on the next slide, just as Taylor Swift has made authenticity and storytelling and genuine connection with her fans kind of consistent elements of her brand, at Virtua, we've made orienting to the consumer one of our core strategic imperatives. And I think it's in the simplicity to this approach that I believe is one of our organization's key to successes. So it's why I wanted to share this. So as we go about setting our now, near, and far goals, we're always grounded by these three imperatives and the need for our goals to be both cross-functional and collaborative. And what I mean by that is it would be easy for Ryan and I and our team to go off and set up a bunch of marketing goals and go about trying to execute on them. But we actually multiply our ability to be successful when we share accountability across the board for each goal. So when it came to orienting to the consumer and this desire to create personalized experiences to kind of nurture relationships, we were never in it alone. We had partners in strategy, in IT, in digital transformation, in the medical practices, in our service lines that were all tied to this segmentation and personalization goals. And this all-in approach allows our strategies to be well articulated, funded and resourced, and universally talked about all year and supported by leadership. So as it turns out, there's like many folks in our organization who actually want to be part of touching people's lives and transforming lives the way we get to do in marketing. So with that as our roadmap, on our next slide, our compelling brand promise becomes kind of our compass. And this actually bubbled up right from our brand research. And it was how we could stand out and make a difference in a sea of healthcare sameness. So our stated promise is listening and connecting at every touch point. We will be your partner in health for what matters most. And there's some very intentional words in this statement that we're going to bring through to life, throughout the conversation today, mainly the words listening, connecting, partner, and what matters most. So on this next slide, you can see that our promise came from our brand positioning, which is so lovingly embedded and embraced at Virtua that it sometimes doubles as our promise, our tagline, our culture rallying cry, our North Star, and that is to be here for good. So I've extracted a line from our brand anthem that I believe captures our desire to truly know the people we serve. And it is, there is perhaps no greater need than our need for human connection. Everyone wants to feel like someone heard, cared for, valued, special. It starts with how we show up, our presence, our attention to detail, rendering empathy and reassurance, getting to know someone as a person so we can deliver a more personalized experience. So as we go about bringing marketing strategies forward, it always helps when we can tie them directly back to the tenets of our brand. So as you can see on this next slide, if ever people needed to be seen and heard and valued, it's perhaps right now. Trust lies at the heart of healthcare. It affects individuals' willingness to seek care, to adhere to treatments. It impacts their likelihood to schedule a mammogram or a colonoscopy, to get vaccinated, or to believe there could be consequences to not taking care of their health. And the challenges we faced during the pandemic eroded an already fragile public trust, and we've yet to recover from that. A recent Gallup poll shows that only 34% of Americans say they trust the medical system. So we've always known from a marketing perspective that one size doesn't fit all, but consumers' needs and expectations have become even more fragmented over these past few years. So fortunately, most healthcare organizations are speaking openly about this loss of trust and its causes, and they're putting in the hard work to rebuild trust across segments, work that centers on honoring the relationship, protecting privacy, reducing inequities, being transparent, treating patients as partners, and listening and empathizing, and honestly, just being more human. So on the next slide, you can see that Monigle's brand research shows us that there's a high correlation between brands being human and a person feeling more satisfied. Personalization, empathy, making me feel unique and like I matter. It influences how I feel about the quality of my care, and it impacts how I would rate the provider and how likely I would be to recommend them to others. So think about that: engagement, treatment follow-through, improved outcomes, satisfaction, and ultimately loyalty and advocacy. They all rely on trust. So getting this right checks off a lot of boxes in a win-win kind of way. So on the next slide, where does trust actually start? And I think we could all agree that trust is kind of the foundation of relationships. So with listening, with exploring people's unmet needs, their aspirations, the things that they find difficult in different moments, allowing us to uncover opportunities and understand the drivers of their choice and action. And it's why consumer insights are so important to the process of delivering on a brand promise. It's to ensure that you understand the who, the why, and the what of your audience. Research consistently shows that brands that are perceived to deliver unique and meaningful messages and experiences are the ones that enjoy the strongest trust and growth. So Voice Activated is Virtua's online consumer insight panel. 40,000 members strong as of today. It keeps us curious about what consumers want and need. Without this active and ongoing listening, we would no doubt develop blind spots. And curiosity helps us close the gap between what we know and think we know and what we need to know to build trust and create connections. And Ryan's going to talk a little bit later about the role Voice Activated played in validating and creating our segmentation approach. So on the next slide, as marketers, we know that brand success relies on crafting messages that resonate to our different audiences. And understanding our various audience at a deeper, more emotional level is crucial to hitting those right notes. So think about traditional demographics like age and gender, things that just scratch the surface, right? So demographics are like looking at somebody's ID card. You can see the facts, but you miss the essence of who they really are. And geographic segmentation is akin to knowing somebody's address, but not actually understanding how or what would make them go from point A to point B. So once we had our CRM system up and running and connected to our Epic database, we had the ability to deliver messages based on a person's health history and what the algorithm was determining to be their next best action. We even integrated people's most recent Net Promoter Score based on their experience into the database so that we could change our tone based on whether they were a promoter or a detractor. But moving to attitudinal segmentation has brought us even closer to the heart of connection. It's about uncovering motivations and feelings that are driving decision-making. It's the difference between understanding what treatment someone might need and what would actually move them to seek it. And for us, it's been about fearlessly embracing the uniqueness of each segment. You know, Taylor Swift doesn't try to please every person with every song. She tailors her music to connect with different emotions. And that's exactly what we're trying to do in marketing. So using attitudinal segmentation, our marketing messages are like these love letters personalized for each segment. Think about what happens for all of us when we're talking to a friend. We don't just hear the words, we're listening for the feelings and the emotions behind them. And attitudinal segmentation is about cultivating that level of empathy in our approach to our customers. So on this last slide for me, the attitudinal segmentation is our way of being attentive to the people we're trying to connect with. It's about tuning into their emotions more than just the data, and crafting messages that touches the hearts of our audiences and shows them that we get them, that we understand them, and it validates their feelings. And as we explored how we could deliver compelling content that connects and engages on a human level, we knew we'd need to personalize our outreach beyond CRM algorithms and demographic data. We knew we'd need to improve our targeting so that we can meet the right people with the right messages and the right next steps, acknowledging that while everyone may need healthcare, everyone does not respond to the same appeal. We wanted to enhance our engagement and cultivate those meaningful connections, or risk being an unopened email or an ignored outreach. And most importantly, we wanted to amplify trust and demonstrate how understanding could build loyalty and truly differentiate Virtua's brand. You might say that we were trying to create a little marketing magic that feels like a Taylor Swift concert, unforgettable, emotionally resonant, and leaving everybody wanting an encore. And on this journey to making more authentic connections, we found our perfect bandmates in our friends at Monigle. So with that, I'll turn it over to Grant.
Thank you, Chrissy. Yeah, so we're going to jump more into the mechanics now of the segmentation and start talking about how we actually implement on that challenge that Virtua gave us in terms of really getting to the human behind the patient and understanding their needs and giving them content that resonates to what they want. So if you go on to the next slide, I want to start just by talking about some key principles about segmentation. I think segmentation is a very complicated area when we think about marketing, oftentimes because there are so many different views as to what's the best approach for segmenting and whether you should even segment at all. So if you go on to the next slide, for me, I think one of the biggest key principles is always build your brand strategy first. You know, I think it can be tempting to see the segments, uncover who those different audiences are, and then build your strategy. But actually, you're better to build your strategy based on the needs of the entire market. Then understand the unique audiences and lean your messaging and brand in to those unique needs. I think it's a little bit risky sometimes building an entire strategy based on a smaller proportion of the total market. So start with your brand strategy, start with your organizational strategy, then understand those segments and look at how you tweak messaging and content based on those personalized needs. The next key principle is really about the type of segmentation you should be doing. Now, Chrissy alluded to this earlier on. You know, we have such great patient data, such great demographic data. We can look in our data sets and see, you know, what gender is that person? What conditions do they have? Where do they live? But as we know, that doesn't define them as a human being. And I think that is why we are such big advocates of needs or attitudinal based segmentations. You know, segmenting people based on those common needs, based on that relationship with their healthcare and wellness is a far better approach than segmenting them just on those physical factors. So that's a really key part of this. But as we know, attitudinal segmentations do come with their own challenges that we're going to talk through today. The next key principle is really to then prioritize. I think if you come out of a segmentation with 7, 8, 9 segments, actually creating a strategy and content and messaging approach to all of those segments, it's a lot of work, it's a lot of investment. We recommend actually looking at those different segments and really identifying of those groups, who are the best segments that we should reach out to? And that can be based on a whole range of factors, but the biggest factor that comes into that should be how well do those segments' needs align with what our brand and health system can offer today? Can we deliver best for those segments, better than anyone else in the market? Because if you can, they should probably be a priority. And then our fourth key principle is, of course, being able to activate the segmentation. Where a lot of attitudinal segmentations fall down is the difficulty in connecting them to other data sets and activating them. So it's all good and well me preaching to you all and saying an attitudinal segmentation is better than a demographic one, but as you know, it's very difficult to then actually replicate that segmentation in other data sets that you're leveraging. So we're going to talk a lot today about how you do that and the different analytical approaches you can leverage so that your segmentation doesn't just stay as words on a page. And then finally, the fifth key principle is all about the socialization aspect, which Ryan's going to talk to later on. But this is really important. You know, I think that segmentation is very beneficial to organizations, especially in healthcare right now, given the distrust, given the fragmentation we're seeing. But it actually works for two reasons. One reason is if you can activate it by connecting it to other data sets, we can prove it's going to drive outcomes. And Ryan's going to give you some data later on that shows that. But what I've also found fascinating in my career is even when you can't activate the segmentation that well onto other data sets, it really still works because it acts as a rallying cry to the organization. It actually acts as an internal education tool to get the organization better understanding of the humans they serve. And, you know, even the language of these segments and socializing them and teaching stakeholders about them can help drive innovation and can help drive change to better orient the business for the future of consumers' needs. So those are the key principles. We're going to get more into the mechanics of the study now. If you go on to the next page, at Monigle, we've actually developed a healthcare and wellness segmentation based on our Humanizing brand experience study with over 25,000 consumers. We ran this 2 years ago, and we've actually been checking it the last couple of years to see if it's still validated. And of course, each year the segment sizes change. But overall, we're very happy with this segmentation and the way it enables us to target people on a more human level. Now, on the next slide, I'm going to very quickly talk about the analytical process. I'm not going to spend too much time on this, but we actually use a 3-step analytical approach to get to our attitudinal segmentation. We start with factor analysis, which just helps us structure the data. We then move into cluster analysis to give us our segments. And then finally, we do opportunity value, which helps us understand how we should prioritize targeting based on the value attached to the segments, which I'll talk to in more detail later on. You know, in terms of the types of segmentations you can do, latent class is another one that lots of people tend to prefer. We like cluster analysis because, well, for two reasons. One, it gives you a cleaner typing tool, which I'll talk about later on. And also it allows you to start with more of a theoretical framework versus letting the data just spit out what the data thinks the segments should be. So that's why we tend to lean more into a cluster analysis approach for our segmentations at Monigle. Okay, so enough about the analytics. These are our 7 people segments that come out of our healthcare and wellness segmentation at Monigle. And I'm very going to quickly touch on each of these segments at a high level. There's a lot of detail behind this segmentation, but I really want to get to the activation part today. So if you go on to the next slide, the first segment are the wellness influencers. Now, these folks are actually an incredibly important segment in healthcare. One, because they are very engaged in healthcare and wellness. They value health and wellness. They spend a lot of money on it, and they actually seek very innovative healthcare and wellness approaches. They are also the influential segment, which whenever you're doing a segmentation, you want to make sure you're connecting with that influential group. Why? Because if you convert them, if you build a good relationship with them, they will be your advocate. They will recruit all other segments along with them. And in fact, this segment is one of the biggest growing segments this year. You can see they're actually up 3% compared to last year. They now make up 19% of the total US population of healthcare consumers. If you go on to the next slide, the biggest segment still though in the US is our habitual strugglers. Now, habitual strugglers are kind of on the opposite end of the spectrum of wellness influencers. They are heavily engaged in care, but because they are struggling with their health, with chronic conditions, and really they need our help. You know, they're one of those segments that need our help more than any other group, and they're already engaging us for help, but they feel especially that they need that emotional support as they go through that care journey. And as you're thinking about how you connect with this audience, it's really about being empathetic, not judging them, giving them that emotional support along with the care they're receiving to help them break the cycle that they're going through and stuck in as it relates to managing their health conditions. On the next slide, you'll see our positive preventatives. These folks are super organized, again, very engaged in healthcare and wellness, and particularly in preventative care. You know, they're the type of patient you're going to have coming in for that annual checkup. They'll never miss it. If you tell them they need to have a checkup, if you give them a checklist of the things they should be doing, they will go through and tick them all off. They have that type of mentality. So again, they're a valuable segment because they do value their health and they're very preventative in how they go about managing it. On to the next slide, our fourth segment are our doctor dodgers. Really interesting group, these folks. Arguably one of the more underserved segments. And the name can even be a bit misleading. You know, you would kind of infer by the name that they're deliberately avoiding the doctor. Well, actually, this audience, they're a little bit more blue collar. They're very pressed in terms of their time. They can be working multiple jobs. They have lots of demands, family demands, and actually they're avoiding care because they can't make the time and they are concerned about the cost. And in fact, what they typically do is they prioritize the care for their children over and above their own. And again, they're an interesting group because there's some really good opportunities with this audience as we think about the future, especially if you do have a desire to have a bigger social impact and reach those underserved groups, because they would really value a great virtual solution. Digital tools, virtual care really can help them because it fits around their lives. And like I said, this group's interesting because of also the fact they do strongly over-index with younger audiences as well in the US. So interesting audience, still make up a sizable amount of the population as well. And then the next segment are our whole health managers. So we talked a lot earlier about distrust. Well, this is the segment that distrusts you most. They will come to you as an absolute last resort. They trust themselves more than anyone else. Very self-sufficient. They do their own research. They're all about more holistic alternative ways to manage their health. And they will come to you if they need to. But like I said, they don't trust that health systems have their best interest at heart. They think that you're going to jump to medication too quickly. And they're more looking at holistic solutions to get to the root cause of the issue above medication. Our next segment is the trusting traditionalists. I mean, the name says it all, really. Very trusting. They probably had the same doctor for the last 30 years. They kind of scoff at whole health and some of the things that those whole health managers focus on. Whatever their doctor tells them, they will do. You know, they have complete faith and trust in the system. They do skew to an older demographic. And every year we run the segmentation, they are getting a little bit smaller in terms of size, which if you think about it, makes sense with that pattern of distrust. If the trusting segment is shrinking year after year, and we're seeing some of those younger segments emerge, it kind of makes sense that distrust is becoming more of an issue across the whole population. And then on the last segment here, unapologetically unhealthy. These folks really, you will not see them come into your health system much unless their leg is hanging off. They are not inclined to engage in healthcare or wellness, diet, fitness. These are things this segment would probably laugh at, but they're still here. You know, they're absolutely going strong, very stubborn, very creatures of habit. But, you know, again, they make up 10% of the population. So it's an interesting audience. I know Ryan's going to touch on them a bit later on. We had some surprising findings from the pilot that we sent out where they actually did engage with the content. But certainly of the segments overall, they're one of the lower value ones given their low engagement in healthcare and wellness. So that is a very fast summary of the 7 segments. But one of the key things we like to do when thinking about how do we prioritize targeting for these segments is an analysis called opportunity value. And that's where you actually look at a number of key criteria to assign value to the segments. Now, as a part of our segmentation, we actually have 4 key criteria. But as you apply these segmentations to your own brands, to your own markets, there may be 5 criteria, possibly even 6 criteria you want to consider when deciding which segments should be your priorities. So on this next slide, you can see the 4 criteria that we actually included in our national study. We look at their health engagement. So just generally, how engaged are they in their own health and wellness? We then look at their care engagement. So now thinking about, are they engaging with health systems? Are they going in and using a variety of service lines? How active are they in the hospital system? We also look at their propensity to spend and willingness to spend on healthcare. So for example, our wellness influencers, they really see a lot of value in their health and wellness. So they will spend more on the category as a result. And then of course, the other criteria which we should always look at is influence. How influential is this audience? Are they giving advice to their friends and family as it relates to health and wellness? The criteria that isn't on here that you absolutely should add if you apply the segmentation to your own market is brand fit and needs alignment. How well does what our organization offer fit with this segment's health and wellness needs? That is a really key aspect of this analysis, which obviously we don't have in our national study. But as you apply this type of segmentation to your own brand, you want to be focusing on those segments that really do have good needs alignment with what you offer. And then the 6th criteria, which is another possible one depending on your funding model, is social impact. You know, if you're really focused on those underserved audiences, then you should consider that a dimension in how you prioritize and assign value to each of the segments as well. So on this next slide, you can see how that opportunity value analysis falls out by each of the segments. I mean, really, this just emphasizes how important the wellness influencers are more than any other segment. I think, you know, however you apply this segmentation to your own market, it's highly likely the wellness influencers will always be a priority segment. Why? Well, look at that influence score they have. They have double the influence of any other segment on average. They're also highly engaged in their health, and they're willing to spend on healthcare more than any other segment is as well. Now, of course, the other segments have varying degrees of value, but again, you really want to look at where does my brand fit in with their needs to make that call on whether they should be a priority segment for targeting or not. Okay, so that was a lot about the segmentation and how we do the analysis. I do now want to talk about how we activate the segmentation. I think that's why we're all here today. And I want to kind of tee up some of the modeling and analytics we use to really make this segmentation impactful. So there's 2 key ways you can do this. On the next slide, I'm guessing a lot of you might have heard of this. And the obvious way to activate on a segmentation is a typing tool. And very simply, a typing tool is a series of questions that can be added to any future research study you do that can quickly assign or type every respondent back to the segmentation. And that's really useful if you think about it. You know, if you're doing brand tracking, if you're wanting to do some focus groups to test a new campaign, you can actually have those questions as a part of your screener and very quickly say, oh, okay, our campaign is testing well with our whole health managers, or as we track our brand, we've got to do some more work to gain some traction with the wellness influencers. So it's a very good tool as you think about primary research and quickly making this segmentation actionable on future research studies you are doing. Of course, the real challenge is how you connect this segmentation when you can't ask a question and type people, because that's a luxury if you think about it. With a lot of the data sets we have today, you're not going to get folks to always complete a survey or a series of questions that allow you to neatly segment them. I will say that our typing tool is very accurate. So if you do put it on a study, you're going to be able to quickly classify respondents with 84% accuracy. So it's a really good, accurate way to get your segments on other studies, not so effective at connecting it to other data sets. So this next slide is really, I think, the exciting slide. And what we want to talk about is, well, what do you do when you can't survey people and ask them a typing tool? Most of the time you can't do that. Well, what we actually did with Virtua Health is build what we call a bridging model, otherwise known as a lookalike segmentation. Now, what is a bridging model? What is a lookalike segmentation? Well, in situations where you can't ask people to take a typing tool, you can't neatly segment them based on a series of questions, what you can do is build a new algorithm by actually taking two separate data sets and building a bridge between them. The process to do this is a little bit complicated, but absolutely worth the effort. And what we did with Virtua is, obviously they have a big panel of consumers who they survey. They have a lot of rich patient data behind them. And by getting that panel to complete the typing tool and then connecting that data to their patient data set, you now have a subsample of that patient data set where you have all the behavioral data and the attitudinal segments. Now, with that data set, once it's de-identified, we're able to then reanalyze it, build a new algorithm that just takes the variables in that data set and is able to predict our original segmentation without the questions we used to build it. So it's a bit of an analytical lift. And it's not perfect. I'm not going to lie, the accuracy of a bridging model is nowhere near the accuracy of a typing tool. And in fact, with Virtua, we were able to accurately classify 3 of the 7 segments, 3 of them which were high value segments, the habitual strugglers, the wellness influencers, and positive preventatives. But even those segments, we were only able to predict to 30% accuracy. Now, you may be scoffing at that and going, oh, that's no good. 30%, that's so low. But if you're thinking that, you're missing the benefit. The benefit is instant scalability across a patient data set of 800,000 plus people. And if you're able to even identify 30% of those accurately and send them personalized content, it is going to have outcomes for the organization, which Ryan is going to walk you through in this next section. So it's a really exciting analytical approach that enables us to activate on segmentation without asking a survey every single time. And it can be applied to any data set as long as you have a bridging mechanism to build that algorithm between the 2 data sets. Okay, so I think that's enough talking from me. I am going to pass it to Ryan for our last section in terms of how Virtua activated and socialized this work.
Terrific. And we can keep moving ahead here. I'm going to drill really into the data sets a bit more, and then I'll zoom back out more broadly onto the implementation plan. This did involve a lot of data management, and our close collaboration with IT was really a key puzzle piece in figuring it out. They have an incredible knowledge of our electronic health record system with Epic, and they were integral to making this all work. It was an iterative process as we were building the roadmap to determining how this national model could work within our market in South Jersey. And, again, we started by really understanding the tremendous longitudinal research the Monigle team has been doing over the years. And then we wanted to determine how we could apply it to our own work, not just for analysis, but for activating people in our campaigns. And we used that same typing tool that Monigle used and surveyed over 2,500 people in our market. And what made it quick and easy for us was that panel that Chrisie was mentioning, voice activated. We have over 40,000 consumers, and we've conducted over 100 surveys over the past couple of years. So it's a fast, kind of well-oiled machine for us. And we used the survey to break people into the seven segments. And then we looked at the demographics and the clinical utilization of these people. We also summarized that information across our full population of patients and modeled people with similar characteristics. So when we shipped that anonymized data to Monigle to have them build the algorithm and determine the predictive formula for the segments, there was some back and forth. We ended up actually expanding our typing tool sample because we wanted to cover a more diverse population to make that more representative. And we lined up more information about people's self-care, about technology-enabled digital health, and behaviors that would tighten up the model that you saw were part of this new consumer. And that's what we were then able to scale across the full patient population. All the data were brought into our CRM system to allow for campaign lists and to understand the behavioral responses to our campaigns. And we're now even using our Access Center to add to our representative samples so we can build more surveys into the algorithm when we do an update. We know that people don't just stay in the same segment forever, and there are new people that are coming into Virtua using our services. So we're also feeding current data back into our voice activated panel because we want to study how these segments respond to key business questions that we're evaluating at Virtua. And we can look at all of those consumers, all of those 40,000 by our segments as well. So it gives us a deeper understanding of the opinions and the actual behaviors of these segments. And that's really, a high level look at the process of fusing data sets. Our IT team, who is way smarter than me, was a key part of that team. They did the work, with the predictive modeling formula, the matching and scaling, creating SQL scripts, batch processing, coding, Excel macros, things that I only know enough to be dangerous about. But, same with the Monigle research and technical teams. They really, fused these sets, made that all come together. So I'll move on and, again, back up and from the data sets and talk more about the project plan. And first, we spent some upfront time determining how this project would even work. We had to explain the why around better personalization to get our organizational support, putting it into our annual goals to ensure that we've had alignment across different departments and the resources to do this properly. This is also where we got a clear champion to advocate for us and to clear hurdles. We talked through our research and data integrations. And again, that was an iterative process, which we improved upon during a couple of different phases. When we felt really validated, we were ready to test in a small campaign. And this is where our content and strategy team stepped in. And I'll share more of these results in a moment and kind of what that campaign looked like. But as we were ready to scale, we again built a campaign that would allow us to see if we could improve results for an entire service line, which we would evaluate. And now we're moving into this update phase where new consumers have come into the system. We've acquired some very large practices, and we're building other campaigns, where we can layer in financial analysis and measures of success. So while there's definitely been some challenges along all these phases, our team has never wavered. They've really developed new skill sets, working relationships that they're really proud of. And the results we're seeing are very promising. If you want to keep moving, I'll talk a little bit about my legal disclaimer here. A few things I want to say about privacy, and this is also where, I don't even pretend to be a lawyer on TV, but I think there are a few points to keep in mind. First, as marketers, we're empowered to serve up the right message to the right people at the right time to help them in their care journeys. Segmentation allows us to do this more effectively because we can do it in a way that people care about our message. So sometimes, marketing, targeting, and privacy are seen as opposing forces, and we don't see it that way. We can be progressive marketers and privacy stewards. Frankly, it's our job, and we should really embrace it. So organizations are different. They have different levels of risk that they're willing to tolerate. They may have different interpretations of the law, which is certainly not always black and white. Regulations are always a maze to navigate. So we all work within those parameters. And I think, this legal topic could certainly be its own full-hour presentation. I've been participating in a lot of these conversations throughout our attribution journey with CRM and web and digital, and I know many of you have as well. So we all need legal in our corner, and I think it's safe to say that we're comfortable with what we're doing, and we take privacy very seriously at the same time. Today, again, I'm going to stay focused on strategy and implementation rather than doing a real deep dive on the legal framework. So to keep moving on socialization and kind of our internal rollout, here's a closer look at our initial pilot of the campaign that was just run, when the original segments of people that had filled in the typing tool were categorized into each of those segments. And we decided to just reach out to them to figure out what we can learn. We definitely got their attention, even the Dr. Dodgers. As groups, they opened their emails at very high rates. They responded to the message, and the calls to action. The positive preventative group, they were the ones most likely to take the offer to learn more. They're into their health, right? So they opted into a nurture campaign, and that really gave us the opportunity and the privilege of reaching out to them, about 10 more times, where we could give them timely information across their entire care journey and keep them moving. Our wellness influencers, they responded the most with appointment conversions. And that's great, because after the clinical team serves up an exceptional experience, this is the group, as Grant was mentioning, that tells everyone, and they amplify our message for us. Perhaps, surprising, the unapologetically unhealthy, they had the highest open rates, and they were interacting with our quiz to learn much more about their risks. They might not have been ready to take action, but we should have the opportunity to move them through the patient journey in the future. So we tested a lot of different creative elements here with each segment, and we were ready to roll. But it is where we did face one of our first hiccups in scaling the initiative. Our first attempt to scale the model really only gave us confidence in predicting the 3 highest value segments. And we were excited, we wanted to reach out to those people, but we didn't want to lose the opportunity to connect with everyone in need of services in this more personalized way. And this is where we doubled back to make sure we could make it happen before we opened it up to a much larger campaign. I want to talk a little bit more on the next slide about this personalized content. So one of the keys to our campaign development was building out our own language guide. In addition to the very robust profiles that Grant talked through and that Monigle provides, our team thought about, how would this apply to localized personas in true Jersey fashion, with some attitude and with the authentic style of our Virtua brand. So this process allowed the content team to think about how they would really connect with each group. And this is always done better at a personal level and really thinking about the life goals of those people. For our email outreach strategy, we knew we had to cut through the clutter, of someone's full inbox and unlimited scrolling that everybody does. And it helped us think through those personalized subject lines and the content that would create engagement. After that language guide, if you move ahead to the expanded campaign, you can see, on this next slide, we built an expanded campaign where our segments were layered on a health propensity campaign for digestive health services. And we tailored the content here to each segment, as you can see in these different images. We tested 3 different calls to action for each one of those segments. And we found that the most effective one in creating leads was through health quizzes. People, they did want to better understand their next step from an interactive tool that would help them, do their self-triage or make an appointment or figure out what that risk was, what that next best action would be. In these calls to action, it was this segmentation approach that we had just layered in that tested higher than the engagement of the campaign when it was based solely on health propensity. So again, some great traction there. And I'm going to move on to talk a little bit more about those results and KPIs. As part of our campaign development, we of course had, a set of indicators to measure success. And the 2 initial ones are related to email open rates and conversions. We've established a financial model set up, so over time we'll be able to look at the utilization of these services and the revenue, but it's still very early in the campaigns that we've implemented, and we don't share all of that information quite as broadly. So, again, you can see here what we learned right away is we achieved email open rates that were 13% higher than all of our previous campaigns. And we were already doing really well. We have open rates over 40% in our campaign work, far above, national benchmarks. But we think the new segmentation is bringing us to new heights. And, this becomes even more apparent with that other KPI, conversions to our desired actions, which is occurring at double the rates of the prior campaign, even with a very similar audience. So again, this new layer of segmentation added on to people's health propensities is making a big difference. And again, we were doing really well with before, but the new segmentation adds a high level of impact, and one we look forward to measuring with more campaigns. In fact, and a shameless plug here, we're going to be presenting at HMPS in April, and we'll have expanded results by then to share. So if you want to stay on the tour with us, that's another place to learn more. And we can also talk offline with people on the call who want to explore measures, more deeply. But I'm going to keep moving here and, kind of summarize here that, it worked. We're happy to share that the initial results of our segmentation can clearly show, that the process that we've outlined was a winner. We've attached segmentation to more than 800,000 patients in Epic, and we've succeeded in getting people to take more active roles in their health. Sometimes this is an actual appointment that gave people
We lost Ryan. I think he's frozen. Ryan, are you there? Oh no, he was so close to the end of his piece. Do we want to go on to the next slide? I know we're close on time, and hopefully Ryan's internet reconnects. And in fact, what we can probably do is while he's rejoining, I can address a couple of the questions that have come up in the chat. One of the ones which I think is a great question is, could you give an example of a shared variable that you used as the bridging model between the CRM and Epic, please? It's a great question. So obviously, when we're building the algorithm, we're looking at all variables as long as they're not identifying the person. And what we actually found really valuable is a combination of the frequency of visits, the channel within which they're engaging. So that could be the channel of the visit itself, a home visit, a virtual visit, but also the mechanism for which they booked that visit. Did they schedule online was also a good indicator. And then the types of services, of course, they were engaging in were also a good shared variable to help us bridge between the two data sets. So that kind of answers that question, I hope. And then we had a whole load of other questions submitted. But if you do have a question now, please do post it in the chat. We won't be able to get to all of them today, but we will certainly make sure that we address them after the webinar. So please don't hold back in the chat.
Hey, Grant, I was gonna add in, I know one of the questions that we got in advance was from somebody basically saying that they're a small shop and is this even possible for them, and how could they do something? And they made reference to being in a market where perhaps their competitor could be multiple times larger than them. So I would just let you know that I would consider our team to be fairly small. Even in the different divisions in our team, we don't go more than 1 or 2 deep in terms of specialists in their area. I actually believe, and Grant made reference to this early on, the ability to socialize segmentation inside your organization and what that does for all people in your organization, thinking about your consumers as humans and not in a homogenous group of just people that we serve, but that they all have different needs and wants. And it has been really, really helpful to us. And I believe that our desire to get closer to the consumer as a smaller marketing team is what's allowing us to differentiate ourselves in the market. And we see that in a lot of our studies that take place when people are distinguishing between really great brands in our market, no doubt, that there's something about Virtua that makes them feel more connected and personal. And that's where we've built out our differentiation. And so I would just advise anybody who's on the call who's in a smaller market or maybe feeling they don't have the resources or the capability for this. It is about the partnership, no doubt. It is about the socialization within your organization, but it doesn't take a ton of resources to get this done. It can actually make a big difference.
Absolutely. Welcome back, Ryan.
Wow. I don't know where you guys lost me. I apologize.
It's quite all right. We've got to questions now. In fact, I'll ask you the next question, as there are a few that definitely were applicable to you that got submitted prior to the webinar. How do you see consumers and AI impacting their behaviors and expectations as we look ahead to the future of healthcare?
Yeah, obviously AI is a really transformative technology, and I think there's, a huge amount of change underway. But just, like a lot of technology, I think it's the social factors that are a big part of it. Technology's the enabler, and the efficiencies of AI have contributed to a lot of demand for immediacy and personalization because people are really used to that level of service. So, I think people are, like our segmentation, some people are very enthusiastic about it, about what is moving forward with AI, and I think some are really nervous about it. I think what we have to be careful of as organizations is not to talk over those groups. AI is going to have a huge impact on behaviors and expectations, but it's really different among all of these segments as we started to learn more about them.
Yeah, that's a great answer. And I've seen there's a lot of technical questions in about how to get Epic ready for something like this. I'm not going to put Ryan on the spot and make him answer those now, because I know he may want to get his IT folks to help with answers, but we will get those back to you after the webinar. And I can take the last question before we wrap up today. There was a question that was submitted again prior to the webinar, really asking about how Monigle's approach has evolved in the past 5 years as we look at the segmentation based on the learnings from Humanizing brand experience. And it has evolved. For those who are familiar with the study, we actually did have a different segmentation about 4 years ago. And I believe with any segmentation, you have to completely refresh it every 4 to 5 years. If you're not refreshing your segmentation, there is a risk that a new segment is emerging in the market that you're going to miss out on. And actually, when we refreshed our segmentation, we did see some new segments come through. The likes of the Dr. Dodger really weren't prevalent previously like they are now. I think one of the biggest changes, though, is that shift between that trusting traditionalist and the wellness influencer. Those segments have always been there, but the sizes have basically been completely flip-flopping over the past few years. And I really think understanding how we connect to that wellness influencer is going to be the key for a lot of healthcare brands as we think to the future. And obviously, when we release our next Humanizing brand experience publication in May, we are going to talk a lot to that and the strategies you can use to really deliver personalized content that resonate with that audience. I know we're at time, so I just want to thank Chrisie and Ryan for being amazing partners and supporting us today. And then obviously thank the folks at the forum and pass it back to Daniel just to close us out.
Thank you, Grant. I'm sure the audience joins me in thanking you, Chrisie and Ryan, for sharing Virtua's story. Thanks also to all of you in our audience for carving out time to join us for today's program. Please note that if you asked a question that we weren't able to get an answer to, we will do our best to get you a response, as Grant had mentioned earlier. The forum will also be sending out a link to the webinar recording in the next few days, so be on the lookout for that. Finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar, and we look forward to seeing you at future webinars, or as Ryan also mentioned earlier, at the Healthcare Marketing and Physician Strategy Summit, April 17th to 19th in Las Vegas. Check the forum website, healthcarestrategy.com, for details. That concludes today's program. Thank you and have a great day.